I am here with Joe Randolph, as you can see. Joe, it's great to be here with you.
Thanks.
And a lot of people have asked me as we've been going through these series, they've been asking me, how is the Innovation Institute doing? And we haven't talked about the Innovation Institute for a while, so I wanted to give Joe a chance to just update you. There's a lot of great things happening. Matter of fact, I just came last night from a dinner where we were celebrating our partnership with Cleveland Clinic and the start of the Innovation Lab. So Joe, I'm going to just let you talk for a minute. Just remind people very briefly of what is the structure of the Innovation Institute.
Okay. First of all, thank you for having me here, and thank you for your support, Deborah, and for the board's support in letting us take this endeavor on. And so we're very excited about the potential for what we're doing. And the Innovation Institute was set up, it was actually a spin-off from St. Joseph. It's a for-profit LLC, and there's different elements within the Innovation Institute. The strategic purpose of the Innovation Institute is to focus on innovation and growth. And so we want to tap into the employees, the physicians, and industry to come up with new ideas, new products, new ways of delivering care. And so I'm really excited about what we're doing so far, the people that we're meeting with, the potential for what we can accomplish. And we've done a lot of research, as you know, before we set this up. And I can describe maybe a little bit about some of the relationships or the way it's structured.
Well, before you get to that, one of the things we did when we designed this is we thought it would be great if we weren't doing it by ourselves.
Right.
And so we thought, let's create a model where people could partner with us in doing this. And I just sent out to the team last week so everybody has knowledge of. But again, I want to congratulate you on securing our first partner, the Bon Secours Health System. So you might talk just a minute about that.
Sure. The model was set up to be a collaborative model, and a lot of that comes from the heritage of St. Joseph. But also, when you look at innovation, a lot of the research shows that the real transformational or the big breakthroughs come when people come together to work on innovation. And so the model that we put together has 7 systems that we're looking to bring in as partners in focusing on innovation. And so, as you mentioned, Bon Secours was the second system in. It's always difficult to get that second investor. But we've got several others in the queue, and we're really excited about Bon Secours coming on board. As you know, Rich Statuto was the CEO here, and so there's a history with him and with their leadership. And so we're excited about the potential for bringing in these other systems. The other partner that we have, which is a real key relationship, when we set up the Innovation Lab, we wanted to make sure that it was a make versus buy decision in terms of, do we bring in the expertise and do this ourselves, or do we go out and partner with somebody that's already done it and has a proven track record? And what we found was Cleveland Clinic had Cleveland Clinic Innovations. They have the best track record, the most items that they've commercialized in healthcare. And so in meeting with them, we wanted to make sure they were of like mind. That was real important to us. And they have a very collaborative spirit in terms of the way they approach things. And so you've met Dr. Yes. Graham, and he's the chair of Cleveland Clinic Innovations, the most prolific inventor of Cleveland, and he is very aligned with what we're doing, and we're real excited about that relationship. So the way that works is when an employee or a physician has an idea and they bring it to us, we can tap into the subject matter experts at Cleveland Clinic and have them evaluate the concept or the idea. And if it's something that has merit, then we can incubate it up to the point to where it gets commercialized.
Has Cleveland Clinic talked at all about what happens when somebody brings them an idea and they have to tell them that it's not a good idea?
Yes, and there's actually a way to do that, and so I'm not the expert on it, but they do talk about working with the person, because you don't want to break someone's spirit that has a really good idea. And so there's a way that you can go back, and a lot of times it's not just saying no, it's saying here's what we need to do, or here's the part that we need to work on. So we'll do that, and we'll help them along the way. We brought somebody in that's actually going to be our employee here that started this week, Patricia Eisenhart from Ohio Health. And she's going to be really good. She was in charge of tech transfer there, and so she's going to be the one working with the employees and the physicians. So she'll be the one working on that communication.
So you're delegating that bad news.
That's right. If somebody has a good idea, I'll make the call.
So Joe, talk a little bit about, last night we were at our new space for the Innovation Lab.
Sure.
So talk about what you hope the Innovation Lab will do, what it will look like.
Great. It's actually going to be in Fashion Island. It's a destination location. So when we have these 7 systems, one of the things we're going to do is bring people together. And so it was important that we have a proximity to the airport, that it be a place where people would like to come. And so a lot of the systems, back east or in the Midwest, when we bring them out here in the winter, we thought that would be a good place. But it's also going to be a place for the employees of St. Joseph and especially the Orange County facilities, that they can access and use that. And we'll have technologies there. We'll have simulation rooms. We will have a showcase of products, things that people from St. Joseph have come up with as inventions. We'll showcase them there. We'll also showcase products from technology partners. And so we're looking at bringing in 5 to 7 technology partners that would actually help underwrite the cost of the lab. And so last night, as you saw, we had several of them that were there.
It was pretty impressive because we had Microsoft there and we had Toshiba there and I forget who else.
Verizon,
Gartner. There. So a lot of good partners that we're looking at, and they were all very excited about the space and the opportunity there. Tell me what's been the hardest thing since you've had to start this Innovation Institute.
The hardest thing is, for me, with my background, is I'm not a salesperson. So going out and meeting with these systems, it's a new experience for me. But we've got a really good team. We've had a lot of support, and it's coming along. And I think I've learned a lot. I think we've all learned a lot. But the timing, I don't think, could be any better. With what everybody's facing with healthcare reform and the need for looking for new sources of revenue, new ways of delivering care, I think a lot of people are really open to what we're trying to accomplish.
So yesterday you had a seminar also with some of the people who already have ideas. Can you talk a little bit about that?
Yeah, we had our first physician, or inventor forum, and we invited, physicians to come to the meeting, and we had several of the people that have already submitted disclosure forms. And so
what does that mean when you submit a disclosure form?
When someone has an idea, and you can go to our website to get access to the disclosure form. You basically fill out a disclosure form which describes what your idea is. And we take that, we help you develop that disclosure form. It's a real simple form to fill out. And then we will submit that to Cleveland Clinic, to the subject matter expert, to evaluate to determine whether it's something that has merit. So yesterday we had, even before we've had the first rollout, because we're going to be going to each one of the ministries to talk about the process and explain how it works. But even before we've done that, we've had some physicians that have heard about what we're doing contact us. And so we've got 10 or 12 disclosures already submitted.
That's
8 of
great.
them have patents. And so
8 of them already have patents?
Yeah, some of them they submitted, they've already got the patent, and so they want us to work with them on it. So it's really exciting to think about the potential when we actually go out there and start meeting with people. So there's a lot of excitement.
Yeah, I was amazed talking with Dr. Graham last night that Cleveland Clinic has spun off 65 different businesses from their Innovation Institute alone. That's not including all sorts of other businesses that may have developed from other sources.
Right.
But just out of the Innovation Institute alone, they've spun out 65 different companies. That's a pretty amazing record.
Yeah.
One of the things that I found so exciting about Dr. Graham was his sense of the fact that there's such a need for collaboration. And, at the trustee conference, we were talking about that idea of, going it alone or doing it in collaboration. And so this seems to me to really fit well with us from a model standpoint. Do they have any examples of work that they have other partners besides us in the Institute?
Right.
So what do you have any examples? Or
Sure. Other alliance members are University of Notre Dame. Now, Notre Dame doesn't have a hospital, but they have a lot of tech transfer, and so they want to partner, and they are of a similar mind in terms of the collaboration. And so University of Notre Dame, there's also Virginia Tech is a partner, similar. They have a DO school, and so they've got that in there, and they're doing a lot of interesting work on concussions and football injuries, and so they're another partner. We've got ProMedica. It's a system in Ohio. They've got North Shore Long Island Jewish, who actually, interesting, wants to do some work directly with us. And so
I learned that last night.
Yeah, so it's interesting that the other alliance partners that they have, they also want to collaborate not just with Cleveland, but with the other members. And MedStar is another one out of DC.
And if I understood it right, what Long Island is interested in is maybe some of the business side out of our enterprise development that they might want to use one of our businesses.
Exactly, yeah.
So that's a great, we hadn't even thought about that.
Yeah.
Well, maybe you have, but I hadn't thought about it from a crossover business standpoint.
Exactly. The other one that was interesting is you'll remember Amalga.
Yes.
And Dr. Mark Smith at MedStar, who was the ER doctor that developed that product.
Right.
He is interested in having us work with him, and they may be coming in as an investor, so we're going to be going back and meeting with them. So that was another connection.
So when we go back a minute to the innovation ideas and the innovation lab, so I have this really great idea here, taking from the original Star Trek, which is this little thing that opens up, and then it was a total body scanner. And I could diagnose you from a total body scanner. Are you impressed?
I'm impressed.
Yeah, look, I'm scanning you. So, I mean, is it this kind of advanced technology thing we're looking for, or are there little ideas also?
You know, it can be something big, or it can be something really simple. And what we found is some of the people that are on the front lines dealing with delivering the care, they oftentimes are dealing with some problem they're dealing with every single day, and then a simple solution to it is something that can turn into a big revenue source.
Yeah, one of my favorite stories when we first started talking about this is that one of the nurses within Cleveland, I think she was within Cleveland Clinic, had realized that there was always a problem when patients took showers and the floor was always getting wet, which made the patients more susceptible to falls, which is something we certainly want to work on all the time, preventing. And she created a new kind of shower curtain that has been really successful in all the hospitals.
Yeah.
So I wanted to make sure people understood it's as small an idea as a shower curtain, or as advanced an idea as this pretty awesome, if I could figure out how to work it, scanner.
Yeah, it's impressive.
My staff is going, all right, Deborah, stop playing with the toys. Tell me, when one of the things that I thought, and I want to see what you think now, I thought that often I'd seen organizations kill a lot of innovative ideas because they would get in the bureaucracy and somebody would say, we can't do that, we can't, we've tried that before. And we also didn't have any know-how about how to take a good idea to the market. And so I thought it was important that we had a separate whole organization. Do you think that's proved out right, or do you think are we going to have to work really hard to make sure they stay integrated?
I don't think you'll have to work hard to keep it integrated, because I think that's the whole purpose for doing it. I do think that in talking with others that have done this for a long time, they're very jealous of the model, because they say what you mentioned at the beginning there has been a problem for them. You get, as you know, healthcare cycles. I mean, you have good years and bad years, and when you have the bad years, oftentimes you end up in a position to where they look at making cuts. And so having it set up as a separate independent organization allows you to take risk and allows you to fail forward, is what they call it in the innovative world. And so you can take risk and you learn and make corrections from the failures, and then you can succeed in the long run and make the breakthroughs. And what we found is, in talking with Cleveland Clinic and Kaiser and even Mayo, is having that set up separate like it is and having it to where it can sustain itself is a model that others are envious of.
So how do we get our culture to accept failing? Because, I mean, I don't think we're very prone to failure. Even when I think about non-clinical issues where we try and roll out a new development, and we have a tendency to think it has to be perfect and not go through cycles of development. So do you think we'll be able to transfer that kind of concept over into our culture within the formal part of the health system?
I think so. I think when people see that it's okay to fail, because if you fail, there's really not any downside to it. I mean, because we're going to be the ones that are making the evaluation, taking the financial risk on it. But when you come up with something and there's a success, I think it'll breed more enthusiasm, and I think there'll be more submissions and more ideas that'll come out of that. The other is we're going to work across systems, and so other than just filling out disclosure forms, we'll bring a technology and put it out there and say, here's a technology, how can this be used in healthcare? And we'll put teams together and they'll do crowdsourcing and they can actually work on this and we'll give rewards.
Let me stop for a minute and check and see if we have questions that have come in, because we like to have this be a two-way dialogue.
Yeah, we have. A few of them are starting to trickle in. The first one that I have here, it asks, can you speak to how the Innovation Institute fits in with our strategic plan and mission outcomes?
Couple things. One is the way that we're set up is we're going to have all nonprofit systems as owners, and so we're looking for systems that are of like mind. And what that means when I say of like mind, we're going to also have a community focus. So we're not just focusing on providing a return on investment for the investors or the member systems. We're also looking at setting up a nonprofit foundation that we will work with to develop concepts and products that will benefit the community. So things that may not have a high return on investment but may have a big impact on the community, that's also going to be a major focus for us. And the systems that come into this, they have to be accepting of that and they have to understand it. Also, we're bound by the ERDs. We've committed that we're going to do that and stand up for that. So I think we're very aligned in terms of what our focus is going to be and how we support the systems that are owners.
Yeah, and I would add that I think certainly our ability to improve care is certainly in line with perfect care. I mean, we would hope that we would do things that would allow us to deliver better care in terms of what we're doing and to be able to deliver healthier communities. As Joe said, it was really important to us when we set this up to set up the 10%, the same 10% commitment that we have within all of the hospitals. We've made that commitment to funding a community fund within the Innovation Institute for developing those kinds of ideas.
That ties in very nicely with this next question I have here. And the question asks, why is the Innovation Institute for profit?
That's a good question, and we get that a lot. If you'll remember, and I didn't go through this, but there's different elements within the Innovation Institute. There's the lab, which is the actual incubator that we've been spending most of the time talking about. But there's also this middle piece, which we call the Enterprise Development Group. And that's a portfolio of companies. And if you think of like shared services, in healthcare, we tend to outsource a lot of things. And when we do that, the companies that we outsource to, they get a margin. Obviously, they're operating for a margin. And so we're giving margin away every time we outsource. So our concept was, let's capture some of those companies within that portfolio, and then that margin can go back and fund innovation. And so that middle piece is the piece that will do that.
Yeah, and then our third piece is going to be a venture capital fund. And I think we felt that the structure of a for-profit company would allow us to do what we needed to do. And when you're a not-for-profit, as you all know, there are many kinds of, not restrictions, but there's sort of hurdles that you have to achieve. And we felt that it wouldn't be as easy to achieve those. So we did set this up as a for-profit. But ultimately, it will not be owned by St. Joe's. I mean, we will be a partner in this for-profit. So it's not as if St. Joe's is going to be owning a for-profit. We'll be one investor in this for-profit company.
And I started rambling. I didn't even answer the question. That middle piece, the portfolio of companies, it gives us the ability to set up different capital structures there because we'll buy and sell those companies. And if we were a nonprofit, it'd be much more difficult to deal with that.
Thank you very much. The next question I have here is, are the innovations products focused, or can they include service lines and service modes?
Great question.
Yes, they can. We're not just focused on medical devices or products. They can actually be services or processes. And so there's different ways that we'll get at that. We may put challenges out there if there's a problem in a certain area that we want to work on together. Or it could be that somebody has a concept or an idea and they just fill out a disclosure form.
Yeah, that's the idea of the challenges is one thing I really liked, and just saying a little bit more about that. If you had a particular issue you were trying to deal with in your organization, you could call the Innovation Institute and say, can you issue a challenge, and let's challenge people across the system to try and find a solution to this particular problem. I think that's just a fabulous way of creating all sorts of energy around creating new ideas and new solutions.
And not only across the St. Joe system, but when we have these 7 systems, we can put a challenge out for all the systems and they can have cross-functional teams, or we can challenge by system, and so we can make it a lot of fun. I don't know if you, I'm sure you've probably watched the program Shark Tank.
Yeah.
We've even thought about bringing the CEOs in from each of the member systems when we get it set up and let them be the sharks, and then have people pitch their ideas. So I think we're going to have fun with it.
But we're going to be nice sharks, Joe.
Some of them.
We're not going to be like some of those folks.
Yeah, that's right.
All right.
Can you please say again where to find information about the Institute, how we can track the work they are doing?
Well, you can go to our website, iiforchange.com, or there's
Say
another.
that more slowly.
change.com, or you can go to stjoes.org/innovation and get some information there.
Fantastic. Can you repeat how you submit an idea to the Innovation Institute?
Yeah, if you just go to that website, fill out a disclosure form, and the website again is stjoes.org/innovation, and it'll walk you right through it. But you just fill out the disclosure form. There's a 7-step process that you go through, and then we'll evaluate your idea and get back to you within a set amount of time.
Thank you very much. This next question's probably more for Deborah. It asks, could you tell us more about the Just Culture initiative?
Oh, sure. We've just launched the Just Culture Initiative. The Just Culture Initiative is a way of helping ourselves get our culture adapted to dealing appropriately with errors that happen in our hospital. I think, as you all know, there are errors that happen. There are errors that are just plain human errors. There are errors that are process errors. And there are errors that are negligent or almost criminal. So one of the things that the Just Culture does is try and differentiate what are the causes of those kinds of errors and what is the most appropriate way to deal with those errors in a very just manner, so that you encourage people to disclose the errors so that we're always getting better at identifying and preventing opportunities for errors to occur. And you know, there's a lot in our culture that is a blame culture. Not our at St. Joe's, but in our culture in general. We have kind of a culture of blame. There's an error, who do we blame? And so this is to try and move us away from that kind of response to errors. We are humans. Our systems are run by humans.
Some of us are humans.
Hey, I think Captain Kirk was human. He was just a far advanced human. So there are some of our errors that are within our systems that we can improve, that they're not it's not about tracing back whose fault they were. It is about understanding what led to that error so we can prevent it. So we started with all of the executives, and all the executive teams are going through training around this kind of culture because we feel strongly this is the kind of culture we need going forward.
Great. This next question is probably for the both of you. Can individuals also invest in the Institute and its various endeavors and ideas?
There may be opportunities down the road. There's not anything today, but as we have products, that people are working on, there may be opportunities for physicians to invest in the concepts that come out of it. And in the fund, I don't know if, we haven't got far enough along yet to see whether there's investment opportunities there.
Yeah, we did ask ourselves this question, and we did look into, are there ways, especially when we get into the actual venture capital fund, are there ways to have individual investors? And we don't have good answers yet, so we're still looking at that. But Joe, the question made me think of something else. Maybe you should explain how the structure works if an idea went all the way to market.
And obviously it'll depend on the type of idea that it is. But as we incubate it, we'll look to find capital partners, maybe somebody that's in the same area of product development that we can partner them with to help capitalize it to take it to market. So it basically goes through a process of incubation to where we'll seed a certain amount of money, we'll develop the prototype. After we develop the prototype, then we'll look at does it need to be protected or can it be protected, and then it'll get further incubated where we will either partner with somebody else, raise capital for it, and depending on what it is, and we can either make the product ourselves, partner with somebody else to make it, or sell it.
So let's say we sell it, and there start to be gains from selling it. What happens to that money that comes from selling it?
Good question. Anybody that comes forth with an idea, they will get 40% of any royalties or profits that come out of it. So there's a significant incentive for somebody to bring forth an idea, especially if it's a good one. 40% will go to the Innovation Institute, and remember, we're the ones betting on which ones are good
Right.
ideas, so that's what that money will go
Right.
for. And then any profits of that will go back into the funding innovation. And 20% will go back to the system from where the person resided. So if it's an employer physician that works at St. Joseph Health System would get 20%, the inventor gets 40%, and the Innovation Institute gets 40%.
Great.
We probably have time for one or two more. This next question asks, who can we reach out to explore additional questions and ideas about other ways to connect to the Institute?
Feel free to call me directly or call our offices, and we'll link you up with the right person. So I think our number's listed, but I'll give it to you if you'd like. It's 714-735-3752.